Hello, thank you for watching this webinar about avoiding fraud. It could be such a problem when you hear this word and you're thinking, oh my gosh, how will I ever overcome this problem? And these things happen. Now you may say, I don't commit any fraud, I'm so straight in my office, everything is okay, but there are more complicated issues than that. You see, there are many benefits that can be had if you knew you were doing things properly. And so I would like to discuss with you something which we implement in all of our offices, something which I think would be very beneficial to you, and that is the benefit of having a compliance program. It's been said, and this information is widely available all over the internet, that the Office of Inspector General, it's often referred to as the OIG, since the establishment of that OIG, which has been at the forefront of the nation's effort to fight waste, fraud, abuse in Medicare, Medicaid, and more than 100 other Department of Health and Human Services, which are called HHS. And these are the programs. They believe that an effective compliance program provides a mechanism which in your office will bring at any given time things which are necessary to make you better, stronger, and more along the law. The private and the public sectors together reached mutual goals, and they wanted to reduce fraud and abuse while improving operational quality, improving the quality of healthcare, and reducing also the cost of healthcare. These are important concepts in our country. Many legal firms will also tell you that attaining these goals provide positive results to businesses, the government, and individual citizens alike. In addition to fulfilling its legal duty to ensure that it's not submitting false claims or inaccurate claims to government and private payers, billing entity may at times find additional benefits of implementing an effective compliance program. I tell you, this is something which is close to my heart because in our offices, we always make sure that they have that. I don't take any client or speak to any client unless they know for a fact that they will need to have a compliance program in place. It doesn't take a lot of time and it doesn't cost a lot of money, especially with the way that we give it to them and the way that we present it to them. So I'll share with you some of my research, some of the benefits that I found. And again, this information can be easily found on the internet, but I decided to share it with you today because of its value and the seriousness that we take it in all of our offices. Here are some of the benefits of having a compliance program, a management program. First is improving the medical record documentation, which will, if you put it properly, improve collaboration, communication, and the cooperation among all the healthcare providers in those offices. And not only that, even those processing and using the healthcare information in your office will work together. There's also the ability to more quickly and accurately react to the employees, sometime about the compliance concerns and the capability to effectively target on some of these patients and the resources and how to address these concerns. It's also a more efficient communication system that establishes a clear process and a structure, a way for you to address the compliance concerns quickly, effectively, and also a few other areas. Now you might ask the question, does a compliance management program work? Well, yeah. You see, basically, a compliance management program is an internal review of your billing in your office, of what you do. That's what it is. It's something that you create in your own office to protect yourself and protect your entity. Now again, I'd like to emphasize today that this is not meant to be a detailed instructional video, but rather a general overview of what you will need to do to be compliant. Let me also share some of the steps that you will need to take. First, you'll need to designate a lead individual, somebody who will become the leader in this compliance program, and you'll assign them to the auditing tasks. This person should have written authority to perform the audits, and they should have access, of course, to all the pertaining documents they need to complete the audit. After you've designated an auditing team, and at least a leader with that, you'll be able to perform at least one time 15-minute audit. There are basic steps for that, steps that can be taken. Determining how many services were performed by the provider, at least in the last 3 months. Also recording each date to be audited, finding the number of medical records to be audited and choosing them randomly, and so forth, things like this. In this process, there are what we call 7 basic elements in the compliance program to review, such as the date of service, the CPT code documented and billed, the diagnosis code documented and billed, and so forth. Basically, the key to a compliance management program is to find any errors and properly correct them. And you see, here's what will happen. As a result of your audit, you may have to reprocess your billing. You perhaps may have to refund some money. But irrespective of your findings, you must take the proper action and make the appropriate changes. So, here's what I'd like to conclude with. The OIG believes that an effective compliance management program is a sound business investment. And this is on your part. And this is to build a good entity. Nonetheless, it seems that the OIG at times recognizes that with the implementation of an effective compliance management program, no matter how effective it is, you may not entirely eliminate fraud or abuse or even waste from your own organization. But if you put the sincere effort, you and your billing company, to comply with applicable laws, federal, state, and all the standards, as well as the requirements of all the private healthcare programs that you're connected with, that you work with. And through this, you'll create the establishment of an effective compliance management program. You will most likely and significantly reduce the risk of maybe unlawful or improper conduct. I want to say this now, this is important. I'm not an attorney, and therefore I cannot do and I don't wish to give you legal advice. However, I'm a responsible consultant, and I've been dedicated to my profession, especially as a consultant, and doing this for over 36 years. Well over 1,256 centers throughout the nation, 45 states, imagine this. And I feel that it's my unequivocal belief that if you want to operate a successful business and sleep soundly, I mean on both ears, and know that at night you've done the right thing, your office should comply with the law in its utmost levels. As always, I wish all the best for you, and I look forward to hearing good news above and beyond. So let's make this happen, and God bless you in everything that you do. Looking forward to carrying only good. Thank you. Please subscribe to my YouTube channel and click the notification bell to get my latest update.